My name is Alan Smith. You found your way to the Digital Wellness webinar for April, where we're going to be talking with my friend and colleague, Thomas Germain, about mental health apps and about privacy specifically around mental health apps. So it's very good to see you all today, and thank you very much for joining us. Before we go into the meat of what we're going to be talking about today, I want to introduce a few other people who are going to be, you're going to be seeing around. I think just maybe come on camera and wave perhaps, but Kimberly, who is going to be the person you see in chat, is with me here from CR. And then you're also going to be hearing from Amira, who's going to be slugging through all the questions that come in our Q&A functionality. And then, of course, there's Thomas, who is a reporter with Consumer Reports. How you doing today, Thomas?
Doing good. Thanks, everyone, for joining us here.
And so we're going to go into today a definition of what mental health applications are. We're going to talk about what Consumer Reports tested in regards to mental health privacy. And it's actually maybe going to be a lot of the meat of the conversation, because breaking down what we tested and why is actually kind of a complicated thing. And then we're also going to go into what we learned, hopefully have time for some questions from you all, and get you out of here by no later than the top of the hour. So thank you all for being here. And as Kimberly is saying, really glad to see that folks here are introducing themselves as social workers and people who are coming to this space, recognizing the value of mental health work is really important. So thank you all for being here. So a few quick housekeeping things before we get going. This is going to be an introduction to the application space. That means that we're going to be trying to take this from the ground level, which may mean that it's a little bit basic for some of you who may be building your own apps or something along those lines. But hopefully we can continue to teach you something as we go. And but this is designed to be a baseline conversation. Be on the lookout for acronyms. Thomas and I will do our best to speak as close as we can to plain English, but we're talking about a tech space, so acronyms sneak in. Just flag them for us in the chat, and we will do our best to come back and define everything. We are recording this video to share, which is good news for anyone who is worried that things are going by too quickly, because we will share with you this entire conversation, including the slides and everything, in an email afterwards. So don't panic too much about that. As I've been saying, you have both the Q&A and the chat as a way to interact with us. And then finally, we aspire to have closed captioning for every one of these conversations, but unfortunately our technology let us down today. So closed captioning will not be happening live. Closed captioning, however, will be happening in the video that we send around after the fact. So we can do it in post, but we can't do it live. And please accept my sincere apologies for that. We shoot for it, but we don't always get there. Finally, there is just some guidelines that we want to set up for making sure that this is a good conversation. So when using the chat and when interacting with the folks from CR, we generally ask that you, respect everyone's experience in being here. Please use I instead of they or we or you. Please refrain from any sort of personal attacks and be nice to Thomas and I, please. Please, instead of invalidating someone else's story with your own spin, please make sure that you are sharing your own experiences. And finally, we realize that the audio and technical issues happen. They are inevitable using this crazy Zoom world. We'll do our best, but we can't always be perfect. See the closed captioning problem. By attending this webinar, you are agreeing to those ground rules. And that means if you don't adhere to these rules, we do have permission to take you out of this session. I'm sure that won't happen today, but we'd like to set those ground rules early so that we have a productive space. Wonderful. So with all of that out of the way, we are here today to talk about mental health apps. It's a big category, but there's an even bigger category that you may have heard, which is just generally health apps. That can include all the stuff that's on your screen right now. There's diet and weight loss, there's disease tracking, there's, well, I'm not gonna read them all off, but this is a rapidly growing category and there's all kinds of stuff in here. But we're talking today specifically about mental health apps. Thomas, what was exciting to you about that as a subcategory? Why did you start there?
Well, that's a really interesting question. One thing that I think our investigation really drove home here is that there's a certain level of privacy problems that are present in just about every app that you're using for the most part. And people often assume that the rules are different when it comes to certain kinds of information. And I'm thinking specifically here about health information, right? And that's because people are used to dealing with doctors where there's a legal requirement in most cases for very specific privacy rules. But what's interesting here is that health privacy laws don't actually protect data just because it's related to your health. They only apply to certain kinds of what are called covered entities, which usually means doctors or health insurance companies or the businesses that they work with directly. Anyone who's a social worker here or works in the healthcare space is familiar with HIPAA, the Health Insurance Portability and Accountability Act, which lays out some guidelines here, but it often doesn't apply to apps, even though they're collecting the same kind of information a doctor might.
So we're going to get into the details of HIPAA and a couple of other parts that Thomas just opened up there. But first, I want to set the parameters of mental health app a little bit closer here. So we're talking specifically about those apps that you might have seen that focus on connecting someone directly to a therapist or therapist resources and support. We're talking about those apps that are maybe taking people through guided meditations, which also kind of fall under this category, mood tracking. And this category, just specifically of mental health apps, is growing at a rapid rate, and it's growing to meet a very real need. So Consumer Reports did a survey, and we found that 4 in 10 Americans across the board have reported experiencing depression or anxiety because of the pandemic. So just in the last year, and that has corresponded, perhaps logically, with the absolute explosion in these mental health apps being in all sorts of marketplaces, and they're coming fast and furious. And the fact that they're coming fast and furious is another challenge in the work that Thomas and the CR testing team has been, trying to wrap their arms around the speed and the ferocity at which these things are coming out. So we're going to talk a little bit about the specific apps that we tested, but then we're going to try to generalize as much as we can about what those 7 apps can teach us about the entire space. So we both want, and CR wants to underline the fact that mental health is especially important in this moment of isolation, of difficulty around the coronavirus. So we hope that this conversation is in no way chilling, is in no way a detriment to you seeking any sort of mental health yourself, or seeking to advise other people to get the help that they need. Instead, what we're going to try to do is to define the privacy concerns that we did find, and hopefully give you some understanding about what you're giving up by using some of these apps. So Thomas, can you help me, because I haven't really nailed this yet? There's sort of 2 kinds of data that we're worried about when it gets to how mental health apps are collecting information about you. Can you share them out?
Right. And before I do, just one thing I want to pinpoint that you mentioned just a second ago. I think it's really important that people understand that we did find some privacy problems in our reporting here, but none of them were so serious that we or I personally would ever advise people to never use one of these apps. But there are some trade-offs involved. The goal here is to help people understand what those trade-offs are so they can make an informed choice. So it's useful here to break up the information that we're talking about into 2 broad categories, right? There's the fact that you're using a mental health app, right? That you are a person who's downloaded an app and logged into it X number of times per week, stuff like that. And then there's just about everything else, right? There's information about your particular mental health conditions, if that's a factor for you, or the things that you've typed into the app, or your communications with a therapist, if it's an app that connects you with a therapist, whether that's over text or through a video call. That's a separate, it's useful here because we were able to do some really clear analysis about that first category of information in data that identifies you as a person using a mental health app. And then there's the rest of that, which is in probably for most people, probably in most cases, a more sensitive category of information that details about your personal life and personal mental health status. So what we found is those two categories of information are handled differently by most of the apps that we looked at.
So the first category again would be me saying the world knowing that I, Alan Smith, have downloaded and am using an app to maybe connect to a therapist. Well, just the fact that I'm using that app. And the second category might be the transcript of what my therapist and I talked about, or maybe the questionnaire where I mentioned that I was experiencing depression or suicidal tendencies. That's the kind of distinction that we're trying to draw here, because as Thomas said, they're handled very differently. And that's an important distinction. So if we have, go ahead.
Oh, so that's exactly right. And I think one point that we're going to get to in a second is it does seem like they're handled differently, but it's also, there are some open questions about that second category, that everything else category of information that we weren't able to answer using the tools that we had. We have some idea about what the app's practices are, but that first category of information, we've got some clear answers.
So we know that these apps obviously are collecting both types of data, and we don't want to undersell maybe the importance of that first type being collected. So some people might not want the world to know that they have downloaded any of these apps. It might not even matter to them what happens inside it. Just the stigma or the social stigma of needing mental health work can be something that people don't want out there in the world. And the individual identifiers that come with me, Alan Smith, downloading that app are part of a package. So there might be other information that would link back to people knowing that it was me. Then there's the second piece of that. There are clear consequences to us knowing what happened between you and your therapist, or even how you filled out a particular questionnaire. That could have very real world implications if any of that information got out. But all of these apps, whether they are mental health apps or just part of the larger health app world, or even just part of the global app marketplace, are trading information as part of their common use. And that is, as we're going to get into a little bit here, but that's mostly that first category. That's mostly the who's using it and how, but that information is part of the common use. And then obviously there's always a real concern about data leaks. We've all seen that companies that professed to keep all of their information behind closed and secure doors don't always do that as well as they'd hoped. So there's a general buyer beware label we want to put on all of this, which is that nothing is ever quite as secure as people would assume. And now finally, we want to get into that last thing, or one of the things that Thomas mentioned, is that you might be thinking, because the word health is in the category of this app, that mental health apps are in some way legally responsible for doing more because of the HIPAA Act. And so I want to get people involved here for just a second, which means we're going to bring up your first poll of 2 of the day. And hopefully you see a poll popping up on your screen. Please don't worry if you don't see that, or if for some reason it's not working, but just to see if people are with us and paying attention. True or false? The Health Insurance Portability and Accountability Act, otherwise known as HIPAA, and that is an acronym we'll be using a lot here, protects the personal details of individuals when using mental health apps. All right, I'm seeing most people have gotten a chance to vote, so I think that looks great. But basically, a lot of you correctly identified that that is false. And as much as we might hope that that is the case, Thomas, tell us, well, I guess start off with what is HIPAA supposed to do? And since it's a 1996 law, how is it adjusted or not adjusted to the fact that we now live in a digital age?
Right, so this is a huge topic, and it's actually one of my favorites because I think it just speaks to the problems of the internet and privacy in general. So HIPAA, which is for those who maybe aren't totally familiar, that's the main federal health law that sets out privacy rules for how information related to your health is handled. And it lays out very specific set of guidelines for what doctors and insurance companies and other healthcare providers can and can't do with your information and how they have to protect it. But it was written and passed in 1996. And it has been updated in some ways, but it really doesn't address the problems of the internet that we're facing today, because the internet didn't exist as it did in 1996, or as it does today in 1996. And the way that apps handle information, the way that data has become a commodity, just wasn't an issue back then. So I see a couple of people that are asking questions about covered entities, right? So this gets sort of complicated, but basically HIPAA applies to a couple of very specific kinds of covered entities, right? So HIPAA applies not to health information, but to certain kinds of people that handle health information, right? That's most doctors, that's your insurance company, that's hospitals, and then it's companies that those people work with directly, right? Now there's some weird gray area here, right? Because there's these apps that you can use or other online services like coupon apps or mental health apps or, women's period trackers or, you name it. All those apps, unless they're connecting you directly with the doctor, HIPAA does not apply, right? So you can go to your therapist and you can say, I'm depressed. And HIPAA lays out guidelines for what your therapist can and can't do with that information and what the privacy rules are. You can type I'm depressed into an app, and in most cases, there are no rules about what that app can do with that information, as long as they're not lying to you in their privacy policy. So they can say in their privacy policy, we're going to sell this information to anyone who wants to buy it, and that's perfectly legal. Now, some people, someone in the chat I saw pointed out an interesting distinction here, right? Some of these apps do connect you with therapists, with covered entities, right? And in those cases, we get into this weird, complicated gray area where HIPAA applies to these apps in some ways, but not others. It applies to certain parts of the apps. It applies to certain kinds of information. But the bottom line here, if we're going to have one big takeaway, is you shouldn't assume when you're using an app that the same rules apply that would apply when you're dealing with a doctor. In a lot of ways, it is the Wild West, which is sort of it's become a cliche when we're talking about rules about the internet, but it is really true here. You can talk to the federal government about this like I have, and in some cases, there just aren't clear answers to what the rules are regarding your personal information.
So let's take this out of the theoretical and into the practical for a second, because we actually did test 7 of these, and we tested them on a couple of different guidelines. This is just real quick, the images of the 7 that we selected. 7 Cups, BetterHelp, MindDoc, Sanity and Self, Talkspace, Wysa, and Yoper. Many of these apps are not designed to be said aloud. They are internet speak. So there were a couple of different categories that the team used to analyze these apps, right? So we have data testing, and we're going to tell you what all of these things mean. Data testing, design review, and then a lot of what Thomas has already been mentioning so far is a deep dive into the policies, their terms of service and their privacy policies, to see what these folks are claiming. Thomas, I want to know why we selected these 7 and what they suggested to you in this space, because we didn't use some of the ones that might be more like some popular ones you might have heard of, Headspace, for example. What was your decision-making matrix there?
That's a great question. So there are hundreds of apps that you can download. If you go into the App Store on iPhone or Android and you type in depression, you'll see tons of options that you can wade through. And the analysis that we did was extensive, so we couldn't do it with all of them. So we decided to narrow it down to mental health apps specifically, and as part of our selection method, we decided to focus on apps that are really pitched as apps for mental health care. Headspace is sort of in this in between because it can address some of the same issues, right? And some people use it for mental health care, right? Like meditation is one form of treatment for certain problems, but it isn't. It doesn't describe itself as a mental health app, so we decided to separate that out into a different category. And then one other level of nuance here, we focused on A, the apps that were the most popular, and B, we tried to get a sampling of different kinds of apps. So that's something that's interesting here. Some apps connect you directly with a doctor. Some apps have just this like artificial intelligent chat robot that you can talk to that does, guided therapy exercises. Some apps are like a community board where you can talk about the issues that you're going through in your life. And then there's, apps that do all kinds of things like that. So we wanted to get a sampling of the different options that are available in this space.
And do you have a sense of like from the beginning and end of this project? Do you have a sense of how many other apps were popping up and becoming popular? Is this like a whack-a-mole situation, or are these was it still the right 7 at the end that you set out to test?
That's a great question. Yeah, there are tons of apps, and you see more apps. I don't know necessarily popping up every day, but it is something that comes up. We tested the most popular ones. BetterHelp and Talkspace are definitely the leaders in this arena. I was happy with the choices that we made because I think something that's interesting is, like we talked about earlier, the law and the rules apply differently depending on what the app is doing. So we wanted to get a feel for a sample that's representative of the different kinds of services that are available. And I think we did a good job there. So we didn't test every app. We didn't test every popular app, but our goal was to just get a feel for what was going on in mental health apps in general, to paint a broad picture as opposed to focusing on a couple of bad actors if we found them.
So let's do another poll real quick. The wording of this matters. True or false? Some mental health apps share your personal details with social media sites and big tech companies. Now, of course, the specifics of how we worded this make a world of difference. But it looks like lots of you were paying attention. And as you correctly surmised, this is true. We saw that BetterHelp, Sanity and Self, Talkspace, and WISA apps were sending data to Facebook as one example. So let's see here. Which of the many jumping off points do we want to take here, Thomas? Because I think that personal data here, you know what, let's start with this. So if information is being shared with Facebook, let's break down a little bit about what shared might mean and whether or not share is the same thing as sell.
That's a great way of framing that, right? So a lot of apps share information with other tech companies. And the reason that they do that, and this gets a little complicated, so bear with me here, is coding an app takes a long time, right? There's a lot of work involved. And the way that it's broken down over the decades that people have been developing computer programs is some computer programs they all need to do the same thing, right? Like if you're playing Angry Birds and you're using BetterHelp, those are very different, right? But in both cases, you need to log in, right? So there are these blocks of code that developers just borrow and use to plug into the programs that they're writing to, connect with other services that perform, essential functions for them, connect with advertising companies, and in order to make all that work, you're contracting these other companies that are performing services for you, right? So Google and Facebook have services that can help identify you when you're logging in. They also operate these advertising networks, right? If BetterHelp wants to send an advertisement to its own customers, Google and Facebook can help with that. And then there's all these other companies that help when the app crashes. They collect data and they help the app developer understand why the app crashed, or some apps help with email campaigns, right? Or some other companies help with email campaigns. So this is something I think a lot of people don't realize. When you're using an app, or a website, for example, you're very often interacting with dozens of companies that you haven't heard of. Your information is passing through all these third parties in order to perform the service that you're actually asking for. Now that's not necessarily a bad thing, right? It doesn't have to be nefarious. And it's also how almost every app works for the most part, like the Consumer Reports app, for example. Consumer Reports does some advertising, does some reach out to our members and to try to attract new members. And we use Google and Facebook, which are the advertising companies on the internet. But the problem is some categories of apps, like mental health apps, are collecting more sensitive information, right? The app that BetterHelp, or the data that BetterHelp interacts with, or pick any mental health app, is more sensitive probably than the data that is collected by the Consumer Reports app. And because of that, I think a lot of consumers expect a higher level of scrutiny and a different set of standards for how that information is being handled.
So Thomas, the thing that's on our screen right now, it appears that we're calling out 3 companies for this kind of sharing, but that's only because they cop to it, right? And this is the list that they express, which actually means that the other 4 we tested didn't reveal this at all. Is that right?
That's right. So what you're seeing here, we're not calling these out as bad actors, right? Every app that you're using is for the most part working with third parties here. Now, Consumer Reports, the position that our privacy advocates have taken is that consumers deserve to know who their data is being shared with, right? If an app is sharing your information with third companies, you should be able to go look at the privacy policy and see who those third parties are. And those apps that we were just looking at do spell that out. In a lot of cases, there's no way for you to know, and that's one of the things that our testing did. Now, I think this is a good place to talk about what information we saw being shared. So the analysis that we did on a technical level, where we were watching where information was going, was in a large part automated, right? Because there's certain things you can look for that all apps do the same way, right? When an app wants to advertise to people on Facebook, let's say that the Angry Birds app or 7 Cups, one of the apps we looked at, right? They want to send an ad to everyone who logged in a month ago but hasn't logged in since then, right? And part of the way that works is there's a unique ID number that's associated with your Google account or your Android account, or it's connected to your phone. And these companies share that ID number with other third parties like Facebook, right? They share all like these just lists, these reams of customers that's saying like, these 7,000 ID numbers, these 7,000 people logged in today and they logged in at 3 p.m. or whatever it is. Now, if it's the Angry Birds app, for the most part, should you be worried about that? Facebook knows that you downloaded the Angry Birds app and use it, who cares? But if it's a mental health app, right, or let's say Grindr, which is a gay dating app, right, the fact that you're using that app is sensitive information, right? So we didn't see that these apps were sharing, your conversation with your therapist, or the mental health problems that you have, or the surveys that you filled out, right? They might be. We asked them, they told us, no, we would never do that. But we could not see with the tools that we used whether or not that was happening. But what we could see is that they were sharing information that identifies, some of them were sharing information that identifies the users with these third-party companies. And what that means is, if you look at Facebook and Google's policies, for example, that information might be wrapped up in their advertising system for other companies. So it's possible that you might see an advertisement that is leveraging the fact that you are a person who is seeking care for mental health, because these companies share data about you with these third parties.
In the chat right now, Mary wants to know, so was the research able to get at what data was being shared? So she wants to know, was it location, like partial IP, or name? And how did those, like, what's the...
Great question. So we were able to test whether they were sharing your name. That was something we could type in and search for. When you're looking at the traffic that's going back and forth, you get these just reams of information that are often encrypted in ways that you can't decode, even if you can. decrypt them. You know, it's not written in plain text. You don't always know exactly what's going on. We didn't see the apps sharing anyone's name. We didn't see the apps sharing, you know, again, details about your mental health. But we did see in some cases, somebody asked about fingerprinting, right, which is a way that apps identify, you know, particular users. So we saw in some cases that, you know, information about your IP address or your Wi-Fi connection was being sent to some third parties. But the most sensitive thing that I think we saw here was these ID numbers that identify you, that are part of the ways that all of your information is connected up across the internet for the purposes of advertising. We did see that being shared back and forth. And does that seem like it gets at the question there, Alan?
I think it does. I think it does. And then I want to like just to make sure we capture everything on this slide before we push forward, because so there's another whole category right here that that really wades into this gray area between what's special about mental health apps or health in general versus the larger app world, which is research, right? And the we found, right, that many of these apps specifically did opt you in, maybe sometimes without telling you, to a potential to have your data be used for maybe your de-identified data, but still your data used in research in some way. Is that right?
That's right. So it gets a little complicated here, right? Because in healthcare, you know, doctors and public health experts and hospitals and pharmaceutical companies are doing research using health information in order to develop drugs or other, you know, medical interventions. That's the way that healthcare works in the United States, and it's a standard practice. So some of these apps say that they do that, right? If you read through their privacy policies, they let you know that we use some of the information that we collect for research purposes, and we share it with academic institutions in some cases, or with healthcare experts. But some of these apps blurred the lines between, you know, this research that's being done for public health and research that's being done for business practices, right? So if you read through the privacy policy, it's not clear exactly, are you using this information in order to make more money, to make the app work better, to market your services, or are you using it because you're trying to, you know, create a better way to help people or help doctors find a better way to help people? In some cases, these apps say that they remove identifiable information. That can sometimes be sort of a red herring, right? Because like we were talking about those ID numbers earlier, right? Like Facebook doesn't care for its advertising business what your name is. Instead, they use these ID numbers to connect up your information, sort of like a routing number. So sometimes they say we de-identify your information. That's not always this balm for your privacy that you might assume. And then there's one other thing that we looked at, which was whether or not you can delete your personal information if you're not comfortable with the app's practices. Some of these apps say you can, but often it's very difficult to do. Sometimes you have to reach out to the company over email and ask them to do that. The same is true of you know, these apps that are doing research with your personal information. Sometimes you can opt out, sometimes you can't. Sometimes when you can opt out, you have to, you know, fill out a form or like go find the email buried in the privacy policy in order to do it. One other piece of the puzzle, and we should move on here, is that apps that are connecting you with doctors, or any service that is connecting you with a doctor, is required by law to hold on to some information for a certain period of time. So the app BetterHelp, for example, connects you with therapists. They can't delete all of the information they collect by law, but it is sort of complicated, and you might not know what to expect when you're going in there. And we think that's an issue that consumers shouldn't have to deal with. You should know exactly what the rules of the bargain are before you enter into it.
So okay, let's see. I think we've mostly covered this actually. Well, okay, so there was one. Let's push forward, because we had a question in both Q&A and in chat about basically like, should these things be illegal, or what should the world look like? And so Consumer Reports does have a stance on that, and it gets to some of these things. But so maybe we were talking about like, this is how the entire web of applications works. If you got to wave your magic wand, Thomas, how should it work? Should there be a distinction between these different kinds of apps, or how could this all be better?
Well, I think that's a great question. It's my job, I'm not an opinion writer. It's my job to go out and find what the facts are. But what I can tell you is everyone that I've talked to, for the most part, thinks that information about your health is different from information about, Angry Birds, right? And if and a lot of people expect that their information about their health is going to be treated with white gloves, it's going to be handled differently. If consumers have that expectation, then probably the rules should be changed in a way that, doesn't disrupt the entire world of, healthcare, in order to match up with consumers' expectations, so they're not being surprised at the end of the day when they find out that their information is being shared with other companies for the purposes of advertising. Part of that, I think, is that all of the privacy advocates that I've spoken to said it shouldn't be hard or complicated for you to figure out what the rules of that bargain you're entering into are, right? If an app is going to share information with Facebook that identifies you as a user of that app, you should know that. It should be easy to figure that out. You shouldn't have to wade through this privacy policy that's written in legalese in order to suss out what the rules are, and they should go above and beyond in order to make it perfectly clear what is being done with your personal information. I think that's something that consumers want, for the most part, from all of the companies that they deal with, because privacy is becoming an issue that people care about more and more. But I think it's especially true when we're talking about information about, your political preferences, or your health, or your sexual preferences, or your finances, right? These are all more sensitive areas. And there should probably be specific guidelines that lay out rules that specify that information is handled differently. And the other thing that I think goes along with that is people generally, as far as I can tell, the ones that I've spoken to, assume that their health information isn't going to be monetized by advertising companies. And if that's the case, even if it's the way the internet works, even if all of these apps share data with Facebook in the same way, perhaps the ones that are handling health information shouldn't be allowed to do that.
If nothing else, though, the very clear call for at least be as open with how you are sharing this data in a clear and understandable way, so that an individual consumer can make a choice. And then we can get into a little later about overhauling HIPAA or changing the rules of the road a little bit more.
Yeah.
Okay, cool. That's wonderful. Thank you for that overview. And then, given that this is the world that we live in now, let's talk a little bit about what people can do, what they should do if you do want to use one of these apps, because I do want to track back. I've seen a couple comments zip by about, well, then I just shouldn't use these apps, right? We do want to track back to where we started, which is not necessarily, we don't want you to leave feeling like none of these are good, or that they are walled off to you entirely because of privacy concerns. We do suggest, however, that you really go through and review their policies and their data practices, because there is information in there, and you can decide based on that whether you're comfortable with the amount that they are sharing out in the world. We do recommend that you look for the word licensed. This can really get into the thing that Thomas was talking about, this gray area, because once you're connected with somebody who is licensed, then there's a much better chance that those people are one of the people who is in fact covered by HIPAA in their own right, and therefore is taking more time to work on this.
But if I could interrupt for 1 second there, I think there's another important point there, which is that some apps that are out there in the world connect you with people who are supposed to help you with your mental health because it's a mental health app, but they're not necessarily connecting you with licensed therapists or social workers. There are plenty of apps that will do that. And if you're looking for care for your mental health, you can find licensed professionals who can help you with that, whether you're using an app or any other method to get care. And that's something that you should find out before you use one of these apps. And it should be perfectly clear when you're going through the app's website or the app itself, what kind of person you're connecting with and what their qualifications are.
Yeah, and I guess if I look at this with clear eyes, I guess number 1 and number 4 on this list are in many ways two sides of the same coin. Use all the privacy settings that the app does allow for, but don't assume privacy by default. And as Thomas has been drilling again and again, don't assume that any of these apps by definition are HIPAA compliant or covered under that law. And then there are always other teletherapy options that are not kind of in this web o apps that reaches itself out to so many different parts of the world and so many different parts of the internet. And then finally, before we get to questions and answers, a couple of resources that we do like that avoid all of the things that we're talking about now. The National Suicide Prevention Lifeline. The number is on your screen, and then crisis text line, which is a text-based version of a similar program where people who are in immediate crisis can get free confidential support regardless of where they are in the day. We will be sending these resources around as well, but the worry that Thomas and I both had maybe in the article and then in planning this webinar is that this would be, like we've been saying, a reason to not go to some of the resources that are out there for you if you are needing help. We don't want that to be the case. So here are some other resources for moments of concern. Thomas?
Yeah, I think that's really important. There is a stigma associated with mental health. I think that's really unfortunate. There shouldn't be. Life is hard. We all have struggles. Some people struggle more than others, but this is, a normal part of life. I see a therapist for my mental health once a week. I don't think it's anything that anyone should be ashamed of. But some people, feel as though that information should be private. No one should know unless you choose to tell them that you're using one of these mental health apps. And something back a couple slides ago, I don't think we need to go back to it, but one of the pieces of advice that I think is really clear is, we're in the middle of a pandemic, right? You might not want to go see a mental health care professional or a doctor in person. That doesn't mean that you have to use one of these mental health apps. There are lots of other services that you can use. For one, you can find a doctor that will connect with you over Zoom, right? And there are some particular, teletherapy or video conferencing services that are built for HIPAA. But even if they aren't, right? If Facebook finds out that you use Zoom, who cares? If Facebook finds out that you use BetterHelp, perhaps there's some stigma involved that you might not be comfortable with. But the bottom line here, I think, is that these problems we found are not so severe that you should decide not to use these apps if you really need help. If you need help, seek it out. There are options available.
So you just evoked Zoom. I think that is a great classic example of the kind of two different kinds of data thing that we tried to kick off this conversation with. So Bernie in question and answer asks, what if a therapist uses Zoom for her client read sessions? Can Zoom use what is said during such a therapy session? So that, first of all, evokes the fact that like anybody knowing that you use Zoom doesn't really carry much of a stigma. Everybody uses Zoom. I'm on Zoom, I don't know, 45 times a day. But the fact that
right now,
here we are, so the fact that we are using Zoom is kind of invisible on the internet. But then what is actually said over this conversation? We're recording this conversation now. Thomas, do you have any insight about about Zoom as an app or how that fits in?
I do. So, most apps on the internet, Zoom sometimes partners with advertising companies, and there might be some information that is passed back and forth with companies like Facebook that says like this user logged into Zoom today. Someone asked specifically, I heard you mention, can Zoom use the things that I'm saying to my therapist? I would be shocked if that was happening. I can't prove for sure that it isn't. I don't work at Zoom, but that's just not part of that company's business model, as far as I know. It's also technically difficult, to analyze the speech that's being passed back and forth in a video chat. People, I think, assume that the internet and technology works a little better than it does. It's pretty difficult it would be difficult to make that work, but I think you should assume it's not happening. And the other thing I would add here is some apps offer encryption, right? So the things that are being passed back and forth, whether that's chat or video, are transmitted in code that's not readable by anyone other than the person that's receiving it. So only the two people on the chat can see it, and Zoom sitting in between that call can intercept it. And as somebody pointed out, Zoom and a lot of other video chatting services have HIPAA compliant apps. They have like a separate service that is built for healthcare that doctors can use. And you can ask your doctor if there's what option they're using and whether it's HIPAA compliant, whether it's built for HIPAA. Some of them are free. If you have a personal therapist you're connecting with, there's one called Doxy, DOXY. You could ask your therapist if you could work with that. It's free. They might shift over if they're using a service that isn't HIPAA compliant. But I think the bottom line is the real problem that we were talking about here, like Alan mentioned, is just the fact that you're being identified as a user of these apps. Not as much of a problem if it's a video chatting app as it might be if you're using a mental health app.
Which gets us to another excellent question. Do you know if background check software like Instant Checkmate or People Finder, are they able to share or figure out that you've downloaded any of these apps, be it Angry Birds or BetterHealth?
That is a really great question. And I can talk about it, but I can't tell you the answer definitively. I haven't heard well, maybe we should back up here. People might not know. There are these services on the internet where you can look up a person, and these companies buy and sell information about individual people, where you live, what your income is, what you do for a living, your phone numbers. There's this really, kind of shady business out there that just like has your information up for sale on the internet. You might have come across it if you ever Google someone's name and you get this result that says like, hey, pay us $5 and we'll give you their phone number. I haven't heard that one of the things that these services do is, dictate which apps you use. But it's certainly possible that there could be, a list of the apps that you use out there on the internet somewhere. So that's something to keep in mind. But I don't think that is a particular concern here with background check apps. And it's something that I have been following over the years. So I think I would know if that was something that you could come across. I see someone asking, what is Angry Bird? That's a great question. Angry Birds is a very popular game, or it was a very popular game that I've been referring to. It's just my placeholder for any random app on your phone. It's kind of fun. You might want to try it if you're looking for something to do. It's basically like bowling. You get this bird and you can flip it and throw it at boxes and knock them over.
It uses physics very nicely.
Yeah,
it's a physics game.
Pretty satisfying.
Okay, so one other question, right? So it's just a placeholder for generic other app. Insert other app name here. So we talked, I think you mentioned this in passing when you were talking about licensed therapists versus other options that might be coming up on an app. But Ron wants to know, any thoughts on the mental health apps that use chatbots to interact with you with a person?
So there's two categories to think of there. There's apps that connect you over chat, over a text chat with a therapist. And then there's some that have these like robots that you might have played with in the past, just on any random website, or it sort of works like Alexa, right? Where it's got this, artificially intelligent system where you type stuff in and it gives you back responses. I am not a healthcare reporter. I'm a technology and privacy reporter. But from what I have heard, from the therapists and, academics that I talked to for this story, is there certain kinds of therapy interventions that can be delivered over an app that are really effective. And one of them is called cognitive behavioral therapy, where it's a system of retraining your thought process and reactions to certain problems in your life. And this might not be the question they were asking, but I'll get to it. But the point is that's something that could be delivered over an AI chat that might be helpful, or whether or not it's proven. Some people use these AI chatbots and they find them to be helpful. As far as their efficacy, I'm not exactly sure. But what I can tell you is, when it comes to the privacy concern, if an app is not connecting you with a covered entity, right, as HIPAA defines it, specifically a healthcare provider, a social worker, a doctor, a therapist, then federal health privacy laws do not apply to that app. And they can, for the most part, do whatever they want with your personal information as long as they're not lying to you. Now, we didn't see any companies that are selling your information. I don't have any reason to believe that these companies are targeting ads at you based on the things that you're typing into an AI chatbot. But it again boils down to the simple answer, which is I wouldn't go into one of these apps assuming total privacy. I think that would be a mistake. So you have to think about that before you decide to engage with them.
I think I know the answer to this, but last question before we begin the wrap up. And there's a bunch of stuff in the wrap up, so don't do the bell rings, leave class early, please. But if an ad is app supported, did you see any evidence that the past problem with ads passing malware or spying in Android-based apps occurred during any of your testing? I think I know the answer to this, but that was a good question from Bill.
I can tell you that's not something that we were looking for specifically, but we certainly didn't come across it. And the problem of malware being passed along through advertisements, for people who don't know, there was a story recently about how the ads that you were seeing and perhaps interacting with on the web were essentially installing viruses and other problems on your device, whether that's a phone or computer. I didn't come across that, and especially with these like bigger players that are dealing with billions of dollars and millions of people, I would expect that there's a higher level of scrutiny about which ads are being shown in the apps. So I would assume that's not something that you need to worry about. But again, you got to keep your guard up with that and make sure that you're working to protect yourself.
So we got wind. Thank you, Thomas, for the wonderful answers. And if we're going to get to a few things in our wrap up here, but before we get there, Consumer Reports is officially supporting AB 1252 in California. So this is a law which would extend California's statewide version of HIPAA to include health apps, specifically also including mental health apps. So we don't have our usual link to send a petition just yet, but if you happen to be in California on this call right now, you can call your reps in support of AB 1252. And as always, we're, as California goes, so goes the nation. There's always a chance that good legislation that works in one place can be passed on to other parts of the world. So we don't have any current CR activity around reforming HIPAA necessarily, but that's just something to think about. And then a final question that I'm seeing here, someone asked whether you think, Janice asked whether creating a phantom person online in order to use mental health apps. Probably that's not worth the trouble for a couple of reasons, mostly because the Facebook or the personal identifier that you're using probably knows more about your actual self than the name or the made up information that you're putting into the app. And then also because we don't want people to be putting themselves in a position where you're lying to your therapist before you start. That's always tricky. You want to have an open and clear relationship there. So probably that's not going to help all that much.
You're not going to fool Facebook by giving them a fake name. They collect lots of other information that can identify you, unfortunately.
They know. Okay, so a couple of things as we're getting out of here. Please join the mailing list. If you go to the website that we will send around in the big email that will come after this, there's be a way to sign up for all of our future digital wellness workshops. There's also follow-up emails like we've been saying with every link that was mentioned in this chat, including some of the resources that we mentioned on the way. And then I want to put a little plug in here for hanging out with Thomas. So there is a link that we'll send around and hopefully that we will drop in chat here real quick, which is a 7-day digital privacy cleanse, where you can it's basically an email once a day for 7 days, where Thomas will take you through all the things you need to do to make your world more private on the internet. Thomas, tell us anything you want to about that before we get out of here.
Yeah, it's pretty cool. Just briefly, we put this together, and the idea is, we want to lay out what the privacy problems that we're dealing with are. It can feel overwhelming, and all the things you need to do to protect your privacy. What works, what doesn't? Should I use a fake name, right? It can just feel a little out of your control. So what we tried to do here was to we build a sort of a game, right, where we send you this one email every day, where I give you background about a particular privacy issue, and then I give you a quick activity that you can take on to address that problem. So by the end of the 7 days, if you sign up and you do each activity, by the end of it, you will have accomplished this larger project that would have taken too long to do all at once, and will leave you better off, better protected, leave you with a little peace of mind that your data is a little more under your control, and then we'll give you the tools to go farther and go deeper down the rabbit hole if you want to keep going from the 7-day challenge and work on your privacy even more. It's kind of fun. Sign up.
And the link that we just put in the chat and that we will send around, you will find this particular newsletter in the far bottom right-hand corner of the page that link will get you. It's a link to all of the Consumer Reports newsletters, but Thomas is in the bottom right, so check it out. It's a big, scary eyeball. I think that's it. We are definitely out of time. So if we missed anything, or if you have any questions that you still would like answered, community@cr.consumer.org. We'll all be there looking. And thank you so much for taking the time to come hang out with us today. Thank you for your excellent questions. And we really appreciate the time and the investment.
Thanks, everyone.